Hey team, it's your nurse educator Amy here, and welcome to the last video in our series on ventilator basics for nurses. In this video, we're going to be talking about how to put all of that knowledge together so that you can apply it to your patient at the bedside. So let's get started. So over here, I have all of the modes of ventilation listed that we've discussed. At the bottom of the list, I have CPAP as that is our lowest acuity mode of ventilation as our weaning mode. Then we have SIMV, volume control, and PRVC, which I've grouped together for the purposes of this video as they are maintenance modes. Then we have pressure control and our advanced ventilator setting of APRV or bivent. Now, as the patient gets sicker, they would move up this list. As the patient gets better, they would move down this list. Now, an important concept that you need to know as a nurse at the bedside is how sick is your patient, but also what tools do we have available to us to help our patient if they are not doing well. And I like to refer to this as how many moves do I have to make? Okay, and let me explain that a little bit further. So let's say you just got a report on your patient and you hear that your patient is on the APRV settings on 100% oxygen and their other settings are maxed out. They're pretty much at the very top of what we can do for them. So that means if your patient decompensates further throughout your shift, we're really limited on what we can do to help them improve their oxygen levels. As opposed to if you were getting a report on a patient that was on PRVC and their FiO2 was 40%, if they decompensate on your shift, I have a lot more moves or interventions that we can make to help them out. So this is an important concept that I want you guys to be thinking about when you're getting a report on your patient, but also throughout your shift. Now let's dig a little bit further into what are some of the typical interventions that we can do with the ventilator to help our patients that are hypoxic. Well, if you have a low SpO2 or a low PaO2, which you would see on an ABG, these are going to be our main interventions that we would do. Typically, your provider and RT will want to increase the FiO2 setting on the ventilator first. And again, that's just going to supply the patient with a little bit more oxygen. Maybe their body at that moment in time just needs a little bit more oxygen to get them over that hump. If that doesn't work, the next intervention that's most likely to happen is the RT or the provider can increase the PEEP on the ventilator. And remember, PEEP improves oxygenation, so the PEEP setting is going to keep those lungs open even more. And that's going to theoretically increase the amount of oxygen levels for your patient. Now, if increasing the PEEP doesn't help, really the last thing that we can do is change the ventilator mode on the ventilator. So that's where we would go from maybe PRVC up to pressure control in the hopes of improving the patient's oxygen levels, which again brings me to my point of how many moves do we have in our toolbox to make to help our patient improve their oxygen level. And again, if you're starting all the way up here, you're not going to have a lot of moves to make to help your patient's oxygen levels. Now, with all of these interventions, we should be monitoring our vital signs and our AEGs frequently to evaluate what we are doing at the bedside to see if it's working. So I hope that this video series really helped improve your knowledge on ventilators. Be sure to leave me a comment below and let me know how this helped you, and if you would like to see future videos on even more advanced ventilator topics. I'll see you in my next video, and remember to subscribe so that you don't miss out any more on my videos. Bye!